according to doctors and health workers in the Eastern Cape, the health system there has now collapsed. Reports of patients dying in the corridors of hospitals have also surfaced, as a number of institutions have no ICU beds or oxygens for those in need of ventilators. Staff shortages have made matters worse, and coronavirus cases in the province are continuing to rise. This is also compounded by the health department there declaring bankruptcy. Health experts, Professor Lungile Pepeta, is with the Nelson Mandela University. He's at the health faculty there. He says that the number of COVID-19 cases in the Eastern Cape could double in the next 10 days. The Prof joins us now via Zoom from Port Elizabeth. Prof, that's quite I guess a frightening prediction, for lack of a better term, especially because according to the NICD, by the end of this month, the Eastern Cape could have upwards of 400,000 cases, of which 78,000 are actually critical. Does the province have a fighting chance to be able to survive this pandemic?
I think the province would need to have a strategy that is actually quite fast to turn this around. We don't have time. We need to act now to be able to survive this.
And, you know, those warnings have been said from the very beginning of the pandemic, and I guess that's raised questions about whether we've ignored the signs that have always been there. And part of the reason why I asked this question is because it appears the only people in the country that are not surprised about where the Eastern Cape is are people in the Eastern Cape, and that, some people might say, is because they've always known that we'd get here.
Yes, I think we've always known that we're going to run into trouble, particularly in the Eastern Cape. And one of the reasons why this is the case is that if you look at the ratios of the healthcare practitioners to that of the population, they are much lower in the Eastern Cape compared to the rest of the country. And also one is aware of the fact that we've got resource challenges, particularly in terms of the infrastructure challenges compared to the rest of the country as well. And yes, economically, we are not economically sound as a province compared to the other provinces as well. So, and these are facts that are well known to society.
Yeah, exactly, and I guess that makes this even more urgent because we've always known. But my understanding is that you've also been in conversation with Premier Oscar Mabuyane about, I guess, a way to respond to the pandemic. What are some of the Premier's most pressing concerns, given what's happened over the past few days?
I think the Premier is aware of the challenges around the healthcare practitioners and the systems and trying to support the system. And the Premier is very open to the idea of having an expert panel team that supports him and the province as well. And that team has been part of the extended provincial command council. And they are invited to be part of those deliberations that take place there, and they are allowed to have input in terms of how we take this issue forward. But also, these teams now need to be part of the operational teams that work from the Department of Health and the other spaces. I think what is important and what the negotiations are is what has been happening in the Western Cape as well, where the public sector is negotiating with private sector to say that they sign MOUs or contracts where we can see movement of patients from public to private facilities as well. Because then, as I said, we're going to require all hands on deck when it comes to dealing with this pandemic. And Premier's office and the Eastern Cape Department of Health office is open to this idea, and this is encouraging news at this stage.
Do you think the provincial government optimized on the time provided by the lockdown period in order to prepare for what we're seeing now?
Yeah, I think there was a need to move faster, but there is also now a chance to change the strategy of not having to build from ground the field hospitals that are needed, but to swiftly repurpose existing infrastructure, just so that we shorten the time frames that we need in terms of putting up such structures. A good example is repurposing of the new Dr. Shapura Nguyen field hospital in Port Elizabeth, which took only 7 weeks. We don't have much time left if we are to build those hospitals, and they'll be ready in October, by which time we may have reached or gone past the peak of this pandemic. We need to look at the facilities that public works has or government has, whether they are in the hospital grounds or they are halls, the municipal buildings, and repurpose those quite fast. provide for field hospitals in the hotspots areas. These would be OR Tambo, these would be the Buffalo City, Chris Hani. At least in Port Elizabeth, we've got one that is up already. That's the strategy that I would support that we actually go for.
You know, Prof, you keep mentioning that we're running out of time. According to some reports, the province is well out of time, with recollections of people dying on corridors, with some even fighting for oxygens, according to some of the Sunday newspapers. Given all of that, do you think it would be a wise decision for the provincial government to allow pupils, more pupils, to be able to go back to school from next week?
That is really very concerning. It requires a discussion and a system to see how that is rolled out, and it does require that it's carefully considered. I have concerns about the spread of this disease personally, that system would need to be revised as far as my concern is. As we've seen that in one school there were 200 cases that were there. I would want to know if then we take these kids back to school, what the plans are, and it would depend on from district to district and also from the type of school. For instance, there are quintile 1 to 3 schools that have got huge volumes of kids that are concentrated in numbers. In one class, you'd have about 80 to 100 kids. And then there are those that are quintile 4, 5, and private schools that would have 12 to 24 kids where there is enough social distancing or physical distancing. And they certainly have more facilities to actually prevent the spread of COVID-19 than the others. So we live in that society that is an unequal society, unfortunately.
Yeah, you know, for better or for worse, the Eastern Cape isn't the only province struggling with a shortage of resources, you know, chronic issues within the health sector. I'm interested to find out why you think it may be that the province, despite that, appears to be standing out insofar as the calamity is concerned with responding to this crisis.
Yeah, there is another aspect in the Eastern Cape which is very worrisome for me. The issue of the unions making demands in a time like this. Now, I am not saying that the unions are not right sometimes in making those demands, but my concern with that is that sometimes there is lack of education amongst the health practitioners themselves, and the way in which we handle the issue of PPEs, and we put on PPEs. It is not unusual, and you probably have seen yourself in the media, where you see a nurse walking leisurely on the grounds hospital outside a ward of a patient, for instance, that has got COVID-19, and yet they are wearing full-on PPE, which is a concern for me. You see a porter with not transporting a patient, but taking some of the goods from one area to another, and they are wearing full-on PPE. And that, in a strained environment, leads to the shortage of those. So there is a need to educate society, to educate health practitioners themselves in terms of what a PPE is and what are the various grades of PPEs, and how can we manage those effectively without having to be wasteful around those. So education is very key regarding that. But also the management itself in terms of the management of these PPEs, stock taking, rolling them out becomes very key. And we've heard that there are some challenges regarding shortages. So in a differentiated manner, we need to bring in this. And also, I think for me, a unified voice of the management of the Eastern Cape Department of unions, private stakeholders, private sector, a business, municipality, universities as well, will contribute a lot in terms of saying, look, we want to have one solution towards all these problems that we have. For instance, you don't have the knee-jerk response when it comes to health workers in the private sector, whereas we see that a lot when it comes to civil society and public sector institutions. And that adds a lot of strain in a strained system already.
In a context where frontline workers who I presume have a level of experience appear to not understand how they should be responding to this pandemic, according to you, how will roping in medical students to help fight the virus help, which is, I understand, another recommendation that you've made?
Yes, I think for me, health practitioners, students from nursing to emergency medical care and other clinical spheres and medical students as well, there would need to be a tailor-made course for them to train them about COVID-19 and about various risk areas when it comes to this disease when one joins a health facility.
But
so
who's going to train them?
It's going to be key from the institutions that are sending them there. And also that will contribute towards its stigmatization of the COVID-19 pandemic. Because also another issue that challenges us, including the healthcare workers themselves, is the issue of one being stuck on wanting to be tested if they worked with a colleague that turns out to be COVID positive, even if they are low risk and they are asymptomatic. That has got to be revised. It depends on whether they were wearing full-on PPE or not at the time, and what do we mean about contact. So all those sorts of things, again, need to be emphasized when we look at issues of testing, because one of the other complaints that we had from the health practitioners when we read about these things is that they complain about not being tested. I want to be tested and I want to be retested before I return to work, which is not possible if you are asymptomatic and you are low risk and we are doing fine, really. So that's what we need to educate our colleagues about regarding this. Without having said, okay, I've not been tested, so I'm going to stay at home for 14 days, which places a strain already in a strained system, is a problem for us all.
Very quickly, Prof. I mean, this moment, wherever you are in the world, needs decisive leadership. It needs a clear head and a sober mind to be able to deal with the complexities that you've outlined. What's your evaluation of how the leadership in the Eastern Cape has fared so far, given what's happened?
I think the leadership alone, whichever way they are dealing with this, it would have strained them, because if you look at the number of heads that are there in terms of having to deal with this very big province, they have no chance. There are just too few people managing a very complex system. So we're expecting them to fine-tune the management of this pandemic alone, as the management of the Eastern Cape is expecting a little too much. It was already a struggling system in general without COVID-19 compared to other provinces when it comes to health service management. And now COVID-19 is added to the burden of all the conditions that they have to manage. You can't have a handful of DTGs that must manage a pandemic of this nature. They certainly need extra hands to assist them in managing it. And they have no standing chance if they are alone in fighting this pandemic.
No, certainly a cause for concern. Thanks very much for your time and for your insights. I certainly appreciate it. That is Professor Lungile Pepeta, who's Dean of the Health Sciences Faculty at the Nelson Mandela University. Prof, thanks very much for your time indeed.